Well, I wanted to thank you for coming in today. Can you please introduce yourself and tell us about you and your specialty, basically?
Absolutely, I'd be happy to. I am a small animal emergency and critical care specialist. And then I wear a whole bunch of different hats. I often feel like I have, 3 or 4 part-time jobs because I'm, assistant editor for JVECC. And, with the whole burnout and big change that I had to make in my life, it really shifted my feelings towards balance in the vet profession. And of course, we all know there's been a lot in the media lately about the high rate of suicide in veterinarians and the mental health struggles that a lot of us face, and I can personally identify with that. And so my interests have really shifted towards how can we enhance wellness in the profession, and not just talking about the issues that we know are present, but what can we actually do about them. And so one of the other part-time hats that I wear is to do meditation and yoga retreats for veterinarians and technicians, and really actually anybody in the veterinary care profession, because we're all affected, from the front staff definitely to the technicians and down to the veterinarians. And so really educating people on what the issues are, and then even more importantly, what can we do to protect ourselves so that we can remain in the profession long term and not have to do what I do, which is a drastic change, which was to leave my job. So.
Absolutely. Let's talk about shift work. I've done shift work, and I recently just did a week of late swing and discovered that my body is not set up for that anymore. But what are we doing? What are your objectives for teaching this? How can we help?
I'm so glad you asked that, because I, like you, recently discovered that I cannot do shift work anymore. And when I first moved to Calgary, I was picking up a lot of emergency shifts and doing a lot of swing shifts, and I thought, I can do this. When I was a resident, I would work overnight. We would work for, as an intern, 36 hours in a row, and everything was fine. And I think looking back, everything was probably not fine. I can remember driving home some mornings and feeling intoxicated at the wheel, which is not good for anybody's safety. But definitely even recently doing swing shifts, just feeling completely just out of sorts the next day. And maybe shocking to some people, but there is something called shift work disorder, where you just never do adapt your circadian rhythm to do the swing shifts and the night shifts. And especially there's certain personality types that are not accustomed to shift work. Those of us who are very regimented, those of us who tend to be early morning people, those of us who are very sensitive to sleep loss, who can't nap, anywhere and any time. That's me. So, but the reality is, because a lot of us work in the emergency profession, it's 24/7. We can't all work 9 to 5. So how do those of us that get scheduled for those swing or night shifts cope? And so a lot of the focus of the lecture is on proper sleep hygiene. So when it does come time to leaving your shift in the morning and going to bed, how can you best do that? When should you be going to bed? What can help you go to sleep? How do you set the stage in your bedroom to accommodate that? Are there supplements that can help? And things like nutrition, incorporating meditation, exercise, all of these things that set ourselves up for success. And then depending on the shift schedule, as both technicians and veterinarians might always be on night shifts, or they might be on rotating shift work, where they go from days to swings to nights and then back again. And depending on how often that turnover is, that's going to affect your ability to accommodate to those changes. And so depending on whether you can truly adjust or whether you just make do for those 4 shifts that you have, there's different coping strategies. So caffeine, how does that fit in, and what is healthy, and when should you be drinking caffeine? Things like amphetamines, of course, we don't suggest. What do you avoid? But certainly, melatonin supplementation, when can that help you get on certain sleep cycles? So I'm just happy to put it out there for people.
can't distill this down to one tip, but if there's one tip for sleep hygiene for shift workers, what would it be?
Oh, you know what? I think I can narrow it down
you?
to one. I mean, it's not going to be the fix-all, but I think more than ever, we are so married to our technology and our phones. And if you talk to the sleep experts out there, that's one thing they say is in the bedroom, do not have your phone. So when it comes time to going home and going to bed and shutting it down, even trying half an hour before you go to bed, shut it off. You're not checking it, it's on silent or it's off. Like it's not, flashing, it's certainly not beeping. And even the electricity of having it next to your bed, a lot of people use their bedside table as a charging station. Charge it in the kitchen or somewhere else. Like it doesn't need to be in there. And people say to me, wow, I use my cell phone as my alarm. Well, an alternative would be to get an alarm clock, a good old-fashioned alarm clock, or you can set the alarm, but then charge it in the hallway. Like put it somewhere where it's just not sitting right by your bed so that you don't have that inclination to check on it. Because it's not just the distraction and the checking on it that you're not shutting your mind off, but even the light that's emitted from your phone messes with our, melatonin secretion and our circadian rhythm. So that's one of the biggest things I read and hear, especially nowadays, where it's like where you look around the conference and everybody is just constantly on their phone. You gotta set that boundary, and maybe people don't know that you're working night shifts, and so they're gonna be calling you, they're texting you, they don't know, but you need to set that boundary. You know what, this is my 8 hours to sleep, and I am not gonna be accessible during these 8 hours.
So next question is going to be about boundary setting and how that impacts wellness in the community, the veterinary community. We definitely have that challenge. I know as a technician, when someone reaches out and says, hey, can you fill this shift? I struggle to say no and to set those boundaries, but I do know that it's important. So how do we do that right? What's the right way?
That's a great question. I think there's two parts to that question. There's the one part that is actually setting the boundary, and then there's the other part that's actually saying no, which I think we struggle with as technicians and veterinarians constantly. I think it's important to identify that though, because we do really need to set boundaries for our own physical and mental health. This shift thing is hard. I have the same struggle where we have a real shortage of emergency vets in Calgary, and so I'll get asked to work shifts, and especially because they're emergency shifts and it's not really my area of expertise, I'll want to help, but I don't love them. And I, if I don't have to do them, I'd rather be focusing on critical care and other aspects. So number one, identification of the boundary is really important. So oftentimes we don't know that there's actually a boundary there, and so we say yes, and then what happens after? We're angry, or we're resentful.
Absolutely.
Or we feel bitter, or whatever. So I think the one key thing is to imagine, okay, if I say yes to taking on this shift, how do I feel? And really tap in physically and emotionally. How do I feel? Do I feel invigorated, excited, happy, elated? Or do I feel sick to my stomach, tightness in my chest, clenching in my jaw, bitterness, fear, resentfulness, that sort of thing? And if it's the latter, if it's, then you need to say, okay, clearly this is something I should say no to. And then it's important in saying no that you say no and that's it. Don't feel like you have to, I'm going to say no right now, because I've got all this, that, and the other going on, because then you're kind of leaving the door open for somebody to ask you again, or to insist. Sometimes we're self-deprecating too. You don't want me to work that shift. Blah, blah, blah. And they're like, no, really, we want you to work that shift. And then you've got no way out. Absolutely. So really just saying, I'd love to help you, and I can see that you're in a bind, but I'm going to have to say no. And leave it at that. And if you need to give one stipulation, it's that you're very busy or you're unavailable, that's fine, but you don't need to also outline what's going on in your entire life and that you have these shifts and this happening in family in town and whatever, because then the other thing that opens up the door for is that person starts to feel like, wow, is it really more important to you to spend time with your family or to walk your dog or to have your day off? Because now you're making work seem less important, and they don't like that. So being clear, about the feeling, identification, I need to say no to this, and then being very clear that it's, thank you for asking and I'd love to help, but the answer is no right now.
Wow, that's going to be tough for a lot of us.
Yeah.
I think that that's a skill we're going to have to practice.
It does take practice.
But we don't have to get it right on the first try. I'm looking forward to maybe the next time attending a meditation class.
And I would love to do that. And meditation is something that is absolutely accessible to everyone.
Yeah.
I mean, you just need to sit in a chair or on the floor, or however you're most comfortable, and then away you go with guidance. So I would love to do that. I think meditation for now is maybe not as conventional or accepted as yoga is. People hear meditation and they think, ooh, I'm floating off the floor and I'm chanting and I'm wearing a long robe. It's not actually like that. It can be like that, but it doesn't have to be like that.
Sometimes it's that deep breath, right, that we take in between.
Totally.
Before we say the wrong thing, it's taking that pause,
Yes.
making that moment.
Yes, exactly, that mindful moment.
All right, well, thank you so much for coming in and talking to us.
Thank you, my pleasure.